Hello, and welcome to Cancer Understanding Your Treatment. This video has been co-produced with people from Lincolnshire who themselves have experience of cancer, along with NHS professionals. We know this is a difficult time for you, but we hope you find it helpful to watch this video before you meet with your cancer treatment nurse, who will also go through this with you and be able to answer any specific questions that you may have. Before you watch the video, you may want to get pen and paper so you can jot down any questions to ask your nurse. You may also want to have someone with you whilst you watch this video, or share this video with your loved ones to watch as well. All sorts of information and support is available to you. At the end of this video, we will give you details of organisations and websites that may be of help. As these will be generic, it is worth checking for organisations and charities that specialise in your type of cancer. Your key worker may also be able to guide you to appropriate resources. We know there is a lot of information to take in, so we have broken this video into chapters so you can take lots of breaks. The video includes information that will be medical. This is to help you to prepare for what to expect. We have tried to explain technical terms as best we can, but make sure you ask the nurse if there is anything that you do not understand. Everyone is different, and your experience of cancer will be different. It would not be possible to tailor this video to you, and also treatments are always improving and changing. So make sure you talk this through with your treatment nurse. This video is for you as you have had a cancer diagnosis. As you are approaching your treatment, we want to support you to be prepared and have the chance to ask any questions you have. We will be focusing on your treatment, so the terminology will feel very medical. If you are watching this online, you will also have the opportunity to go through this with one of your cancer treatment nurses at your appointment. We will now talk you through the aims of this video. This video aims to answer any questions that you may have, alleviate any treatment concerns that you may have, inform you of the important things you need to know whilst on cancer treatment, help you manage and cope with any side effects that you may encounter, and provide you with emergency contact numbers. We will now talk you through the various types of treatment. Remember, everyone's treatment is different, even if you have the same type of cancer. Talk this through with your treatment nurse to help you understand your particular treatment regime. Systemic anti-cancer treatments are often referred to as SACT. Cancer treatments destroy cancer cells within the body or assist your body to kill cancer cells. You may be given one drug or a combination of drugs which act on your body in different ways to treat your cancer. Your consultant will have discussed your cancer treatment plan with you, which may sometimes be called your regime. Your particular treatment plan will be identified on your consent form. There are many different anti-cancer drugs. The drugs you are given depends on the cancer you have. Additional considerations to your treatment plan include your general health, what your cancer cells look like underneath a microscope, and if the cancer has spread to other parts of your body. Types of treatment include chemotherapy, which kills cancer cells alongside some healthy cells, immunotherapy, which helps the body to recognise and attack cancer cells, targeted cancer drugs. These target the differences in cancer cells to prevent them from surviving and growing, and hormone therapy. These help to slow down or stop the number of hormones your body produces to slow down the growth of the cancer. There are a range of ways that your treatment might be given. This may also change over time according to how your body tolerates it. This will be constantly reviewed with you. Treatment may be given using an intravenous drip or injection via a cannula, a central line, a PICC, a Hickman line, or a Portacath. Treatments may also be given using tablets, injections under your skin, or intrathecal, which means this goes into your spine. The frequency of your treatment will be discussed with you, as everyone's treatment plan is different and requires differing lengths of treatment. You will have a blood test prior to each treatment. It is possible that your blood count may not always recover in readiness for your next treatment. A second blood test would need to be taken. The date and time of your next appointment will be given to you at each visit. Cancer treatment drugs are carried by the bloodstream to all parts of the body where they act by interfering with the growth of rapidly growing cells such as cancer cells. The drugs can also affect normal cells that are naturally growing and dividing quickly. These include hair, mouth, bone, and the lining of your bowel. Because of this, you may experience common side effects. However, these may only last a short while as the healthy cells change and regrow. Here we will talk about some of the possible side effects. Some of your cells will be affected by the treatment. This has potential side effects. When the white blood cells are affected, it can lead to infection, and when it is the platelets, this can cause bleeding or bruising. If red blood cells are affected, this can lead to anemia. Hair loss is caused when the hair follicles are affected, and rash or sensitive skin by the skin cells. If the lining of mouth and gut are affected, you may experience mouth ulcers, diarrhea, or nausea and vomiting. Your cancer treatment nurse will discuss in more detail those potential side effects that you may experience with your individual treatment. Neutropenia is a term used to describe an abnormally low level of neutrophils in the blood. They make up the majority of your white blood cells. These cells are part of your immune system and have a major role in fighting infections. Cancer treatment reduces these cells and consequently the body's ability to fight infection, making you susceptible to infection known as being immunocompromised. Your temperature is often the first sign that an infection may be developing. Shaking, shivering, flu-like symptoms, cough, mouth ulcers, sore throat, burning when passing water are also other signs of infection. The longer you leave it to report a suspected infection, the harder it is to treat. Infections can rapidly become life-threatening, so please seek advice as soon as possible. Paracetamol and ibuprofen can lower a temperature. Take your temperature ahead of using these. If you have taken either of these drugs, feel unwell and your temperature is not raised, please call the helpline number that you have been given. You may experience urgent or severe side effects. You can contact your hospital team 24 hours a day, 7 days a week if you experience any of the following: a temperature of 37.5 degrees or above, swollen and or painful calves, temperature of 36 degrees or below, vomiting despite taking your anti-sickness medication, shivery episodes, bleeding, flu-like symptoms, breathing problems, mouth ulcers and diarrhea. Some of these symptoms can be a sign of sepsis, which require urgent hospital treatment and assessment. After contacting the 24-hour advice line, rarely you will be advised to attend the accident and emergency department. If you do attend accident and emergency, please ensure the receptionist and triage nurses are aware that you are on cancer treatment. Remember to take your treatment record book with you. If you have chest pain, you need to dial 999 immediately. When admitted or at your treatment clinic appointment, you will have been given your treatment record book. This book has a list of common side effects you may experience when having cancer treatment. A traffic light system is used to assess how severe and how urgent your side effects may be. Within your treatment record book, these are listed and this can be used by you at home or at any point when you think you may be experiencing side effects. Your treatment nurse will show you this. If you are not sure, call and ask. It may be that advice is all that is needed, but your treatment cancer team would rather you call and check than just leaving it. The telephone numbers for you to contact will follow. Please be aware that the contact advice may differ if you are a patient receiving treatment for a haematological condition. If you are feeling unwell, think you have an infection, or you are having severe side effects, telephone the hospital immediately and where possible have your treatment record book or drug information to hand. If you are able to do so, please take your temperature ahead of calling. You may want to press pause on this video and note these phone numbers down on this slide for future reference. If you are having treatment for a haematological condition, please use the contact details for the hospital where you're receiving your treatment. The side effects that you may experience depend on the drugs you are given, the dose, and how many treatments you have. Your treatment team will discuss these with you when you consent to your cancer treatment and prior to you starting your treatment. You will also be provided with written information on how to manage these. We encourage you to ask questions that you may have about your treatment. Some of the common side effects include changes to your appetite, infection, anemia, nausea or vomiting, bruising or bleeding, and changes to your skin. You may experience extravasation, and this will be explained in a later slide. Other common side effects are a sore mouth or ulcers, hair loss, changes to how things taste, changes to your fertility, diarrhea or constipation. Your consent form will give details of those potential side effects related to your individual treatment. You can ask your treatment nurse for a copy of this should you not have one. Less common side effects include allergic reactions, hearing changes, bladder symptoms, issues with your kidney or liver function, or blood clots. You may also experience eye symptoms, pins and needles, numbness, or tissue damage. Sometimes people can have a reaction to the treatment plan they are on, and allergic reactions to your treatment can happen. Some drugs can cause sensitivity-type reactions. You might experience pain, an itchy rash, facial flushing, lightheadedness, nausea, or shortness of breath. If you experience any unusual feelings during treatment, tell one of the treatment nurses straight away. Some drugs can cause photosensitivity. This is an increased sensitivity to sunlight. Regardless of this, all patients on treatment should use a high-factor sunscreen, cover up and stay in the shade where possible. We mentioned extravasation in an earlier slide. This is a term used to describe the leaking of chemotherapy from the vein into the surrounding tissue. You will be given an information leaflet about this. Immediate action is needed to prevent any long-term damage to the area where the drug has leaked. You need to tell a nurse immediately if you experience burning, stinging, pain or swelling in your hand or arm where the cannula is put in or the PICC site, chest if you have a portacath or Hickman line. Cancer treatment does not mean you shouldn't have sex, but you may not feel like it. You should avoid pregnancy during cancer treatment as it may harm the developing baby. Tell your consultant straight away if you think you are pregnant, or your partner is pregnant if you are receiving cancer treatment. Use a barrier method if having sex during treatment, only for the time actually having treatment and for 2 weeks after. It is not known whether or not treatment drugs can be passed through semen or secretions. If you have any specific questions, please ask a member of your treatment team. Some cancer treatment can affect your ability to have a child. If you are concerned about your future fertility, discuss with your consultant as soon as possible. Female changes might include changes to your menstrual cycle and hormonal changes, and menopausal symptoms. It is possible to become pregnant while you are having cancer treatment. You should continue to use an effective contraception method during your treatment and for about a year afterwards. For men, it is advisable not to father a child for about a year following your cancer treatment. You or your partner should use an effective form of contraception. You will get the best from your treatment if you look after yourself. Take your temperature if you feel unwell and avoid contact with anyone with an obvious infection. Your immune system may be very low after some cancer treatments, and you will be more vulnerable to infections which can lead to sepsis. Food safety is important. Ensure food is cooked well, especially meat, eggs, fish, shellfish and poultry. Avoid unpasteurised dairy products such as soft cheese, blue-veined and mould-ripened cheese. Wash fruit, vegetables and salad, avoiding packaged salads. Avoid takeaways unless you know how it is prepared. For your mouth care, brush teeth twice a day with a soft brush or an electric toothbrush. Use mouthwashes, the alcohol-free ones. Drink plenty and aim for 2 litres or more a day. Seek advice before arranging any dental treatment. Keep your skin moisturised and use unperfumed to avoid irritation. Monitor yourself for any changes such as rashes, bumps, and let your team know. Wash your hands frequently and shower daily. Avoid sitting in the sun and use a high-factor sun protection. Make sure you wear a hat. Your mental health is important too. Keep occupied where possible by doing things you enjoy like reading, drawing or painting. Talk to someone. Chaplains, nurses and the Macmillan team are available to you. Try keeping fit when you are feeling well enough. You may experience decreased memory, concentration, so be kind to yourself. You could also try holistic services, for example Reiki or meditation. Whilst you are advised to continue your normal activities of daily living where possible, and if you are feeling well enough, there are some activities, lifestyle choices, which you are advised to only do in moderation. Alcohol. Always seek advice from your treatment team. Swimming is good for the heart health, but be careful of shared facilities and infection risk. If you have a PIC or Hickman line, you should avoid swimming. Light gardening will be okay, but wear gardening gloves where possible. Please ensure that you have told your treatment team if you are taking or planning on taking any other medicines including herbal medicines, over-the-counter medications, vitamins, dietary supplements, complementary therapies or recreational or illicit drugs. It is important that you speak with your consultant for further guidance before having any vaccines. You may have the flu vaccination and it is recommended that you have the COVID vaccination too. During your cancer treatment, however, you will not be able to have live virus vaccines. These could include shingles vaccine and some holiday vaccinations. Here are some key things to remember. Do everything you can to look after yourself. Monitor your temperature. Contact the hospital immediately if you are feeling unwell. Suspect you have an infection or a severe side effect. You have 24-hour access to advice. Take the medications you have been supplied as directed. Use your cancer treatment record book traffic light system and remember 2 ambers equal a red. If you are in any way unsure, contact the helpline for advice. We will now run through some of the things to expect on the day of your treatment. We all need good support in our lives. We will take you through some of the additional support that is available to you in Lincolnshire. A holistic needs assessment is an assessment undertaken as a discussion. This will be initially undertaken with your key worker, usually your cancer clinical nurse specialist or a member of their team. Together, you talk through your needs and concerns. You then agree on a plan for your care and support needs. It is called holistic because you can discuss any needs or concerns you have about any area of your life. It is not only about the physical symptoms of cancer or the side effects of treatment. These concerns can be physical, emotional, practical, financial or spiritual. This discussion will be repeated around the 3rd cycle of your treatment. You can discuss your needs at any time they change with a member of your cancer treatment team. Others are there to help too. Contact your treatment team for queries about treatment appointments, side effects and medication. You can also contact one of the Macmillan Cancer Information and Support Centres, your clinical nurse specialist team who is your key worker, the community nursing team, your GP, a Macmillan Welfare Benefits Advisor based at St Barnabas Hospice, and the hospital chaplain. It will help you feel more in control of your treatment if you are able to plan ahead. Having a respect form in place is one way of planning ahead for yourself and for those around you. Respect is a form that provides a summary of personalised care recommendations in the event of emergencies such as cardiac arrests. If you already have a respect form in place, bring this with you to all your appointments. If you would like to discuss putting a respect form in place for yourself, discuss this with your treatment team to agree upon your wishes. There are lots of technical words that are used in healthcare. You may see or hear these words throughout your cancer treatment, and this is what they mean. You may want to pause the video and check any of these words you are not sure about. There are also online resources such as the Macmillan Cancer Support website and the Lincolnshire Cancer Support website. You can also find local information if you search for Connect to Support Lincolnshire. There are a number of UK-based cancer websites specific to your cancer. These provide up-to-date information and may provide many other methods of support. For example, discussion forums and support group information. Ask your clinical nurse specialist team for further information. Thank you for listening to this video. We hope you have found it useful. This video has been co-produced with the Lincolnshire Cancer Co-Production Group. The group is facilitated by Lincolnshire charity Everyone and brings people with experience of cancer together to work with services for the benefit of others. If you are interested in joining the Lincolnshire Cancer Co-Production Group, so you can use your experience of cancer to help others, please visit us at www.every-one.org.uk or call 01522 811 582.